Stop guessing what she actually wants in bed. Many women rush straight to penetration. And you've probably taken that as your cue, but what if that rush is a sign of discomfort, disappointment, or duty? Today, I'm clearing up the single biggest lie about female desire. By the end of this video, you'll know the 4 hidden reasons she's rushing, and how to instantly shift your intimacy to a place of deeper pleasure and genuine desire. Hello, I'm Dr. Emma Blake, a specialist in urology and men's sexual health. And I want to begin this conversation by acknowledging a confusion that is deeply ingrained in the intimacy lives of so many couples, a confusion that genuinely perplexes men who are trying their best to be attentive partners. If you are a man who has ever been genuinely confused about what women actually want in bed, especially when it comes to foreplay, I want you to know you are not alone. This misunderstanding is everywhere, woven into the fabric of our cultural sexual scripts. You've seen it in movies, where passion immediately ignites into action. You see it on social media, where intimacy is portrayed as a frantic, instant explosion. And perhaps, most confusingly of all, you may have even experienced it in your own relationships, where a woman seems eager to skip straight to penetration, pushing your hands away, or pulling you quickly toward intercourse. Naturally, you take this at face value. You assume this must be what she wants, that this rapid-fire approach is the key to her pleasure and her desire. But I am here today to tell you, from 2 decades of clinical experience, that in the vast majority of cases, that behavior, that urge to rush, has very different, often hidden, roots. This is one of the biggest, most damaging misconceptions men hold about female desire. And clearing it up is not just about improving her pleasure in the moment. It's about unlocking a deeper, more profound connection, greater confidence in yourself, and a genuine, lasting desire from her toward you. So, let us be direct and clear. Do women exist who want to go straight for penetration? Of course they do. There are always individual exceptions to every rule in sexual medicine. We see women who have very fast arousal responses for unique hormonal, emotional, or specific contextual reasons. Perhaps she has already masturbated earlier in the day and is highly sensitized, or maybe she's experiencing a sudden, intense burst of passion driven by a specific event. But these moments, I assure you, are not the predictable norm. They are the spontaneous exception. After 20 years of studying sexual medicine, counseling countless couples, and having hundreds of private, frank conversations with women about what actually turns them on, I can tell you with unwavering confidence that when a woman consistently skips foreplay, or rushes the sexual interaction, it is rarely, and I mean rarely, because that is her true, most pleasurable preference. Something else, something complex and layered, is happening beneath the surface. She may be performing a role, trying to manage an uncomfortable situation, or simply avoiding disappointment. And to address this, we need to unpack the 4 most common reasons I see in my practice when a woman behaves this way. 4 reasons that have little to do with her finding immediate penetration pleasurable. The first reason I frequently encounter is perhaps the most painful to admit for both partners. She is emotionally detached from the experience and is participating in what we clinically term duty sex. In this scenario, when a woman seems to rush intimacy, it's not because she's impatient for the grand finale of penetration. It is often, tragically, because she is impatient for the encounter to end. Many women have told me, using these exact, heartbreaking words, "I just want to get it done as quickly as possible," because the alternative, a slow, drawn-out process that doesn't lead to arousal or connection, is simply more exhausting than the swift completion of the act. This behavior is what women sometimes refer to, perhaps wryly, as keeping the peace in the relationship. She is having sex, not because she is in the mood, or because her body is genuinely craving it, but because she believes it is her obligation, her wifely duty, or because she desperately wants to avoid the perceived conflict, the guilt trip, the subtle disappointment, or the cold shoulder that she knows will follow if she says no. She is calculating the cost of saying no versus the cost of simply complying, and often, the path of least resistance is compliance, a compliance she tries to expedite. In her mind, the quicker the sexual event concludes, the sooner she can return to a state of emotional and physical rest, the sooner she can relax again without the pressure of performance or the anxiety of disappointing her partner. The act itself has become a transaction, a box to be checked, rather than a joyful, reciprocal exploration of passion. And naturally, if sex is a chore, you want to complete that chore swiftly. You want to minimize the time spent in discomfort or emotional detachment. This shows up in many ways, both in committed relationships and casual encounters. You might be wondering, why would a woman agree to meet for sex, or even initiate it, if she doesn't actually enjoy it in this detached way? This too is common, and it speaks to the complexity of human sexuality. Many women engage in sex for deep emotional or psychological reasons that have nothing to do with immediate physical pleasure. They are seeking validation. They are seeking a feeling of closeness, a sense of being desired, or a temporary external confirmation of their worth and femininity. If her past sexual experiences have not included real, sustained arousal or connection, she may simply have lowered her expectations. She may not expect to feel much physically at all. For her, sex can become symbolic, something to complete, to affirm the relationship, or to secure affection. It is not something to truly savor. So, when she seems like she's pulling you in quickly, or pushing away your gentle attempts at foreplay, it is often an attempt to finish the task quickly, to complete the symbolic act before the discomfort, the emptiness, or the deep disappointment of non-arousal truly sets in. This pattern leaves a signature that you as the partner can learn to spot. Consider what happens immediately after sex. Does she light up with warmth, affection, and relaxation? Perhaps staying physically close, or initiating a post-coital conversation filled with genuine softness and connection? Or, conversely, does she rapidly disengage, move away, turn her back, and seem distant or preoccupied? If she rarely initiates intimacy on her own, if the emotional temperature drops immediately after climax, and if you feel like you are perpetually the one chasing her for attention and affection, chances are high that she is engaging for reasons other than genuine, reciprocal physical pleasure. She is checking a box, and the rush is her way of minimizing the emotional strain of that performance. The only way to reverse this pattern is to slow down, create a genuine space of safety, and prove to her that your goal is truly her experience, not your completion. The second major situation I observe in my practice is rooted quite simply in poor foreplay technique. And let me state this without an ounce of judgment. Most men are never properly taught how to touch or arouse a woman's body effectively. This is not a personal failure. It is a systemic failure of sexual education. What men learn often comes from highly unrealistic sources like pornography, or misleading advice from friends, or a simple process of clumsy personal trial and error. And the techniques they employ are frequently too fast, too firm, or entirely too mechanical for female anatomy and the pace of female arousal. A man might move his fingers like pistons, with relentless, unvarying pressure, instead of using touch as a form of communication, a continuous dialogue that responds to her subtle cues. He might give oral sex with an intensity or pressure that feels rough or jarring to her sensitive tissues. Or he might focus so intensely, so single-mindedly, on making her reach a climax that the entire act feels more like a stressful exam, a test of his skill, rather than a free, pleasurable experience for her. This high-pressure, mechanical, result-oriented touch is the very definition of ineffective foreplay for most women. And what happens when this is the repeated script? The woman gradually starts to dread that part of intimacy. She begins to brace herself internally for the incoming discomfort, the disappointment, or the overwhelming sensation that doesn't actually translate to pleasure. Subconsciously, she develops a protective mechanism, a desire to avoid the awkward or uncomfortable stage before penetration. When she rushes you, when she pushes for penetration right away, it is often because her previous experiences of foreplay haven't been pleasurable or effective for her. It's not that she doesn't want foreplay, it's that she is avoiding the specific, unpleasant kind of foreplay she has come to expect. This is a defensive reaction, a way of redirecting a partner from a guaranteed source of discomfort to a more neutral, or at least less pressure-filled, part of the encounter. This can occur even in relationships filled with deep love and commitment, even when the partner is genuinely trying his absolute best. Sometimes, It is the lingering result of tension or trauma from previous, less attentive encounters. And sometimes, it is purely the result of a lack of skill and confidence on both sides. She may not know how to tell him what she needs, and he may not know how to slow down and truly ask. You will notice this pattern if she interrupts your attempts to touch her before penetration, if she quickly redirects your hand, if she seems stiff or passive during moments of focused clitoral touch. She is not rejecting intimacy as a whole. She is avoiding discomfort and disappointment. The solution here is not to take offense, not to retreat into your shell. The solution is to improve technique and communication by learning the power of the slow, patient touch, the touch that is about exploration and sensation, not just the quickest route to an end goal. It's about building trust in those pre-penetration moments. Again, teaching her body, through patience and attention, that this time will be different, that your hands are safe, that your touch is attuned to her pacing and her unique, subtle responses. This requires a conscious effort to focus on the journey, not the destination, because the quality of the journey dictates the quality of her desire. Now, we come to a third, incredibly widespread reason. Many women rush into penetration. They genuinely think that's what sex is supposed to be, and they have never experienced anything different. They operate under a false script, one that dictates that penetration is the main and only event. For many women, from their very first sexual encounters onward, the pattern was always direct. There was no necessary build-up, no genuine warm-up, no slow, sensual exploration. She simply accepted the pace that was set for her. Think about the education provided to young women. It is almost exclusively focused on risk avoidance, on contraception, pregnancy, and STIs. There is virtually no widespread, accurate education on the complexity of female pleasure and arousal. So, what is the result? Many women have never been correctly taught how their own bodies work. They do not realize that their arousal takes more time than their male partners, that the process is often non-linear, and that penetration, for the vast majority, is not the primary trigger for orgasm. It is at best a secondary or complementary sensation. The problem is that, biologically, the female sexual response does not work on an immediate access model. When a woman starts sex immediately with penetration, her body has often not produced enough natural lubrication. The blood vessels in her pelvis, clitoris, and vaginal walls haven't had the necessary time for full vasocongestion. This is the crucial, physiological warm-up, where tissue becomes engorged with blood, oxygenated, plump, and exquisitely sensitive. If she skips this warm-up, the tissues inside her pelvis are not yet fully ready or responsive. The lack of lubrication can cause friction and discomfort, which is an immediate signal to the body to close down rather than open up. She might still enjoy some sensations, or push through the discomfort, but her overall experience will be severely muted. There will be less depth, less intensity, and significantly fewer orgasms. Because she has never experienced real, gradual, full-body arousal, she may conclude, tragically and wrongly, that she is the one who is broken, that she is simply less sexual than other women. This is a deep misunderstanding of basic anatomy and physiology. It is the equivalent of trying to run a marathon without stretching, or starting a car in the winter, and immediately flooring the gas pedal. The body is designed to be warmed up, to be prepared, to be brought gently into a state of readiness. When a woman finally experiences a slow, attentive, and emotionally safe warm-up, when she realizes what true vasocongestion feels like, most are absolutely amazed by the sheer capacity for pleasure and sensitivity their bodies have been hiding all along. Her rushing is a surrender to a false script, a belief that her arousal is instant and mechanical. And the only way to correct this belief is to gently and consistently introduce her to the reality of her own deeply pleasurable physiology, by demonstrating with your patience that she is designed for a slow, luxuriant process. This brings us to the fourth and final reason, one which is intrinsically linked to the previous point, but deserves its own focused attention. Following the script, driven by the profound fear of disappointing or burdening the male partner, many women learn early in their dating lives, or through observation, or through damaging direct feedback, that men expect penetration quickly, and they do not want to risk disappointing or appearing difficult. They fear being labeled, in the harsh judgment of our society, As cold, as high maintenance, as boring, or as a partner who is simply too complicated to satisfy. So, what is the rational, self-protective response? They play along with the expected performance. They adopt the script that says, "I'm easy, I'm game, I'm ready now," even if that is wildly untrue for their body in that moment. They may appear enthusiastic about skipping foreplay, even actively encouraging the quick transition, but internally, they are simply following what they have been taught, or what they believe is the quickest path to acceptance and affection. They are acting out a role in the theater of intimacy, a role that minimizes friction in the relationship. This internal pressure to perform is immense. A woman may realize that asking for 10 or 20 more minutes of patient, focused touch, or specifically requesting clitoral stimulation, or correcting the technique of her partner, runs the risk of extinguishing his mood or hurting his ego. And so, she self-silences. She sacrifices her own potential pleasure on the altar of his comfort and perceived ease. The rush is a survival strategy, a preemptive defense mechanism against being seen as demanding or difficult. When women act out this script, they are essentially closing off their emotional and physical needs to prevent a perceived rejection. They assume that to be desirable, they must be simple, they must be immediately responsive, and they must be satisfied by the same rapid process that satisfies their partner. When they finally find themselves in a genuinely safe relationship with a partner who is patient, attentive, and secure enough to truly prioritize her experience, they are often emotionally overwhelmed by the realization of how much pleasure and deep sensitivity their body was capable of all along. They find they were never the problem, the script was the problem. The moment she realizes she can ask for what she needs without fear of rejection, the moment she sees the curiosity in your eyes rather than judgment, that performance anxiety dissipates, and the real, passionate woman beneath the mask begins to emerge. This is not just a sexual breakthrough, this is a profound relationship breakthrough, an act of deep emotional trust. So, let's synthesize these 4 reasons. The woman who rushes is rarely doing so because she prefers it. She is rushing to avoid emotional detachment, rushing to avoid discomfort, rushing to adhere to a false belief about her own body, or rushing to follow a relational script born of fear. This means that if you are with a woman who consistently rushes or avoids foreplay, your response should not be to take offense, or to retreat, or to label her cold. Instead, you must adopt curiosity and empathy. Try engaging her gently and kindly, not in the moment of passion, but perhaps during a quiet, intimate moment outside of the bedroom. You might ask, "Do you not like when I touch you before penetration? I would love for you to show me exactly what feels good for you, because your pleasure is my focus." Sometimes, she won't know the answer yet, because quite literally, no one has ever asked her that question with genuine non-judgmental curiosity. This is where your leadership as a partner becomes crucial. Leadership in intimacy is not about dominance. It is about establishing a pattern of safety and slowness. You can guide her body back into comfort. You can prove to her what real, deep arousal feels like. And you can actively begin to rewire her association with intimacy from one of chore or discomfort to one of profound, welcomed pleasure. Understand that many women enter relationships without positive sexual education or supportive partners who prioritize their needs. They may not realize the staggering capacity for pleasure that their body holds. When you consciously choose to create safety and slowness, when you touch her in ways that are patient and attuned, her nervous system begins to trust you. Her tissues begin to open up. That is when she stops rushing and starts truly melting. That is when her genuine desire grows and intensifies instead of fading into duty. So, my final message to every man who desires a better, more passionate, and more connected intimacy life is this: stop assuming she is the rare exception. The overwhelming evidence suggests she probably isn't. She probably needs more time. She needs more warmth, and she absolutely needs more attentive understanding before penetration. Learn to work with her beautiful, complex physiology, not against it. If she rushes, gently slow her down. Use your hands and your lips to create a safe harbor of touch and sensation. If she seems unsure, reassure her with your touch and your words that there is no pressure. If she says she's fine, still take your time, because her body knows the difference between fine and fully turned on. The reward for this shift in perspective is immense. It sets a partner who not only craves intimacy with you, but who initiates it, because she knows, unequivocally, that when she is with you, she will be seen, she will be cared for, and she will be fully, deeply aroused. This is not just about refining technique. This is about embodying empathy and demonstrating leadership in intimacy. Women who feel safe and fully aroused don't have to pretend or play along. They respond naturally. They meet you in that space, willingly, passionately, and with all the genuine enthusiasm you've been wanting all along. You have the power to be the man who brings that true, uninhibited desire out in her, and when you do, you will find a depth of connection that changes everything. Nice.